Greetings, ladies and gentlemen, and welcome to Malaika, the talk show for African Christian women. In life, we have many choices, some very insignificant, but others extremely significant that can affect you for your whole life. Stay where you are. We'll be right back. Abortion. It affects someone deeply, physically, emotionally, mentally, and that's exactly what we're talking about today. And in studio today with the Mama Audrey.
Yes, Jackie, very sensitive subject, but we are glad to have our special guest with us today.
Exactly. Thank you for being here, Auntie Zods and Tatiana.
Faithful to the post.
Thank you. And our special guest, as you mentioned, Dr. Damien Stesuk. Thank you for being with us, Doctor.
Thank you so much for inviting me.
Thank you so much. So as you've heard, we'll be talking about abortion. It is a very heavy topic, but don't go anywhere as we start over with Tatiana's overview. Tatiana, abortion, what do you have?
Well, Jackie, this is a promising series, so we're going to obviously give our viewers good news, but to start, not so great. Well, an abortion, what is an abortion? We probably all know what it is, but allow me to redefine it. An abortion is a pregnancy that is ended by taking medicine or by undergoing a surgical procedure. Well, the abortion debate is complex. It is a sensitive subject that elicits diverse opinions and emotions, and there are two sides of this debate. There are proponents who emphasize a woman's autonomy, and there are opponents who are pro-life, who prioritize the rights of the unborn child. It's important to note that abortion laws, they differ significantly from country to country. Some countries have more permissive laws, and other countries are highly restrictive. Somewhere in between, some countries allow for special circumstances in the case of rape, incest, or fetal abnormalities. Laws in Africa. An estimated 93% of women of reproductive age in Africa live in countries with highly restrictive abortion laws. Only 4 countries have liberal laws. That includes Zambia, Cape Verde, of which I am Cape Verdean, South Africa, and Tunisia. Now we want to look at some stats quickly. In the 2022 State of the World Population Report by the United Nations, that was quite a mouthful. Roughly 121 million pregnancies are unintended each year. 60% of those pregnancies will end in abortion. About 45% of all abortions globally are unsafe. And about 7 million women a year are hospitalized as a result. I can feel the eyes burning on that side of the room, and I'm just hoping these stats are correct.
Yes.
Which he will confirm later for us, thankfully. Up to 257 million women who want to avoid pregnancy are not using safe, modern contraceptive methods. So some key findings in Africa from this report. Some 6.2 million unsafe abortions occur in Africa per year. Africa is the world region with the highest number of abortion-related deaths. The World Health Organization estimates that 14% of maternal deaths were due to unsafe abortion, which represents 29,000 abortions, mothers who died having abortions. Moving on, in closing, psychological effects of abortion. Well, according to the APA, the American Psychological Association, decades of research has shown that the vast majority of women feel that they have made a right choice, who have undergone an abortion, and they don't experience regret, and the prominent emotion that came forward was relief. However, for many individuals, and I would say the overwhelming majority, the experience itself is emotionally challenging. And they may experience the following effects of guilt and shame, of grief and loss, anxiety and depression, post-traumatic stress, or ongoing relationship issues. And on that note, back to you, Jackie.
That's a heavy one. Can you imagine this is the stats that they've actually recorded? And those that have gone to the back streets and they've never seen, they never know what happens, how in reality what the stats actually is. Yeah, it is. Auntie Zods, we'll move over to you. Could you tell us on the ground, please, in Southern Africa, what you found out?
Yes, Jackie, in Southern Africa, clearly abortion in most countries is illegal.
I know that because it's legal in South Africa, most young people that do have means just cross over, go and get it neatly done, and they come back. But that represents a very few people that will have the finance to do that. So most of the times abortions are done by young girls who feel desperately like they're stuck. They get pregnant, and they know, obviously, in African families, falling pregnant out of wedlock is still a big thing. And there's that shame also of being pregnant, so they feel they've got no way out except to abort. And unfortunately, most of these decisions are made in desperation without thought of the effects afterwards. And what tends to happen is, because most of Africa is illegal, including Zimbabwe, Botswana, then in Southern Africa, they end up doing it backdoor. And all sorts of means of ways to abort are done. I mean, it's horrific what these girls have to go through. Things like using coat hangers.
What the baby has got to go through.
It's traumatic both ways, you know, because there's concoctions apparently that you can drink, and the pregnancy will abort naturally.
Poison?
Sorry?
It's poison.
Yeah, it is.
No, if it was poisoned, you would be poisoned yourself.
It would be, yeah, I don't know, but it does work. It's concoctions. It's probably not safe long term for the mother. And then secondly, they use coat hangers. Some of the desperate ones, they will use coat hangers, all sorts of means, and the result being that either the life of the mother is at stake, some die actually trying to abort, or it's the after effects like the infections and whatever happens to the mom afterwards. So it's definitely not a good option. And I know that lately in Europe there's been this push for abortion, but in Africa it's not out of this is my body, this is my right, I'm free to abort. It's more out of desperation, more than anything else. So that's clearly the state of the situation in this light.
Sure.
Yeah.
Sad reality, Auntie Zods. Dr. Damien Steso, could you elaborate on the types of abortion that there are?
Yeah, well, it's shocking to hear all these numbers, but it's sadly the reality, and definitely it's really, really scary to hear what African women have to go through. In modern countries where it is legal, there are actually 3 types of abortion that are proposed. It's either because you want to interrupt the pregnancy because of your own will, so when you were pregnant and it wasn't planned or it wasn't the right timing, and you decide to interrupt that pregnancy. There's another one, it's what we call a medical abortion or a medical interruption of the pregnancy. It's because the baby has malformation. It could be like a genetic disorder like Down syndrome or other syndromes that we know. And the doctor can ask the lady if she wants to get rid of that pregnancy. And there's the third one, is what we call the therapeutic abortion or interruption of the pregnancy, is if the mother is at risk or the half of the mother is at risk, we have to interrupt and stop that pregnancy. The most common one is what we call preeclampsia. It means you have a very high blood pressure at the end of your pregnancy and you lose proteins in the urines. We will stop the pregnancy because you are at risk of dying. And normally those syndromes appear very late in the pregnancy, so the baby should be safe. But if your health is at risk, the doctor will decide for you, and nowadays doctors decide always to prioritize the woman's health and not the baby's health. Are we wrong? Are we right?
Are you saying that the abortion is done on the woman with preeclampsia late in the pregnancy when the baby is full grown because there's a chance of the baby surviving?
There is definitely a chance of baby surviving because it's normally at 8 months of pregnancy, or well, it can be earlier.
It's not an abortion.
It's an interruption of the pregnancy, and that's the 3 ways of interrupting the pregnancy. Either you decide, or it's a medical condition, or it's a therapeutic condition, and then the doctor decides for you.
Okay.
Very clear.
What if the person has been raped? Is there a law about that one? Is it legally okay to abort?
Well, if we take, like, for example, the French law, you can have, you can decide for yourself, but you always have this period of time where you have like 7 days of reflection. That's the French law. If you had, well, if you went through rape or whatever, you can decide till the 14th week of pregnancy to abort. In England, it's up to 22 weeks. I will just remember our viewers that we try in France to resuscitate babies as from the 28th week. It means it's viable-ish if you're in a proper hospital as from 28 weeks. So 22 weeks is already a completely formed, yeah.
It's hard. Even in the mom is at risk. It's actually very frightening to see what's happening. Mama Audrey, I'm going to move over to you. Regarding these women, we've heard from Tatiana the anguish, the pain, and the desperation that they're going through, the condemnation that they're feeling. Could you please address that, please, to these women who are in deep condemnation after aborting?
You know, I suppose we're talking mainly to Christian women.
Yes.
Obviously, I think that the decision of abortion is mainly taken always, it's not something which is well thought about.
Yeah.
It's, you know, when a young girl, a young woman hears about being pregnant and it was not planned, which I don't understand, because today there are so many means to prevent pregnancy, to avoid those situations, that the fear of society, the fear of the reactions of the parents, of the church, when it's a Christian, of the church, is scary. Is scary. Because I remember when we were talking earlier on with Auntie Zod, she was mentioning that in some churches, if you have been aborted, you can never come back to the church.
Yeah.
They put a cross on you. Yeah. So now how will you relieve yourself and be able to get rid of that feeling of condemnation if you're not able to talk about it, which is very important? And who are you going to talk about it, which is not going to bounce back on you? So obviously it's a very delicate situation, and very often this feeling of condemnation on the spot, you know, you're young, you take a decision, you're very happy, oof, it's behind you, nobody knows, you've done what you needed to do. But then, as you grow up, and life takes its turn and it's toiled over you, and you can start remembering, you know,
it would have been their birth.
That baby would have been 12 years old today, and she would have been such a lovely little girl that I would have had. Why did I do that? And it's very hard to go back on time. You can't rewind. And to stop the feeling of what you did, what you could have today, and that you did that. And finally, maybe you thought when you did it, financially, I'm not going to cope, but finally life turned out to be different, and you realized that you could have well done it, and you got rid of the baby for the wrong reasons. Yeah. And at the same time, you realize you displeased the Lord. And who knows, God might have a great plan for that child. So it's not something easy to live with when you're a Christian and when you grow in the Lord, to deal, because it's the feeling of condemnation is well justified. It's normal. So unless you repent and humble yourself and totally come to a place where you forgive yourself, which is, you need grace for that, to remove that feeling of guilt, you will need a miracle. But you know, I'd like to ask Dr. Damien something, a tricky question.
I'm here for it.
A curveball.
If somebody comes to you and it's none of these reasons, it's not a danger, she's not been raped, it's not been incest, it's not been a child and it's a young girl, she comes to you and she says to you, you know, I'm desperate, I felt pregnant, I've been stupid, my parents don't know. Would you please carry out an abortion on me? What would you do as a Christian doctor?
Well, that's a very good question. And actually, I had this situation. I you know, legally, as a doctor, you have to tell the patient what their options are. In Mauritius, the abortion is not legal. So, but in France, it happened to me when I was still a young doctor. So legally, I was meant to tell that patient what her options were. But I had the right, as a doctor, a moral right to say, I don't do that. Mm-hmm. So I told her, those are your options. Now I can tell you where to go, but I won't do it because I have this moral right not to do it. But I would just say that every woman I have seen going through abortion, it was a trial and it was very hard on them.
It was not like doing it with joy. It was, no, it was a tough decision.
Yeah, it's always a tough decision, and we should never put a burden on top of their already existing burden. Mm. So we definitely have to hear them out if they went through abortion, hear them out why and how they feel about it. And if they say, well, I'm relieved, fine. But if you are relieved, but you still have that burden, definitely to be there as a support.
Mm. Mm. I'm glad to hear what you would have done, because not many doctors would have done that, because I suppose there is a great fee that is being paid under the table, and many doctors will go for it. Mm. And there is great judgment waiting these doctors, mainly in countries like America, where the pro-life is getting stronger, is getting voices and support from different governments. And but in the church, it's really sad that girls are not even free to speak to the pastor. Mm. Because, you know, they probably know that the pastor will say no. And they are not ready to obey the advice. And they are not free. Even parents, do the parents speak to their 8-year-old child before they get big enough to say, this is what's going to happen to you, this is what life is going to bring to you, and from that time on you must be very careful and explain to them everything that can happen to them with a relationship with a boy. I mean, if only parents would do that, I think we could avoid many pregnancies, and even tell the girl, you know, if anything happens to you, if you fall, let mama know, that the girl won't think that somebody's going to hit her on the head.
Exactly.
And that the parents are there to support her, to understand her, and if she's going to crash on somebody, it's okay, we'll be supporting you, but that's not good for you, my daughter. But the fact that the kids cannot speak to their parents,
then they're vulnerable.
And they risk their lives.
This is a cultural revolution we're speaking of here, because in the African context, I mean,
you don't speak.
It's only the gospel. What can bring a parent to change its ways, or a mother who has been so rooted and grounded in culture and the way things should be and hidden, as we heard from Auntie Zod's? It's a revolution in the spirit.
Yeah, it's something that's never mentioned, but yet it's so important that girls, I don't know from what age you would say they should be taught, Dr.
Well, we do know that as from puberty you can teach them, and we now...
puberty is what age?
Well, that's a good question, because nowadays we speak about premature puberty as from 7.
Yo!
What?
Yeah, that's...
That is
when you say puberty, you're marking menstruation?
Premature.
Yeah.
I remember...
Get ready.
Mine is 10.
I remember there was a report, there was a 7-year-old girl in Africa who gave birth. She was probably abused and gave birth. So there is no more age now.
Well, actually, if you have the feeling that the child is capable of understanding, you should definitely adapt your words, but definitely tell them and educate the kids as from 7, 8, 9. Yeah,
rather than the school educating them, because then it's educated in the wrong way altogether. It's not at all the way the parents would do, and it stirs reactions.
And the problem is the parents will say, let the school do it, it's easier.
Yeah, because there's a huge taboo with it, and very often parents are uncomfortable. Sometimes I even have patients telling me, can you tell my child what is going to happen? I don't have any problem with that, so because I don't have that taboo, and I will just explain it very clinically. And I tell them, well, that's the male organ, that's the female organ, what's happening, and it's easy. If you're uncomfortable with it, you will make the situation uncomfortable.
Exactly.
But if you're comfortable with it, fine.
Thank you, Doctor, for that input. Mama Audrey, so what attitude should a Christian have towards abortion then?
I mean, Christians should obviously be pro-life, because the Lord is very clear about taking life. It's totally unacceptable before the Lord. So there's no doubt about us Christians taking a stand for the life, for fighting for the life of that child, and not looking at the other side of the right of the mother. There's no such thing. But what is important is that even it happens that somebody could come to us. You know, we did have that happen to us, and we had both cases where I remember there was a woman who came to us, and it was a very delicate pregnancy, and she didn't know what to say. The doctor had said there's very little chances that the baby will make it, and she asked for advice, and we felt like telling her, you know, it's really up to you, because it's the mother who has to decide, because she will be living with it. We can say so much, but we cannot impose and come a religious principle. And we said, but you know, the Lord is able to do a miracle, the Lord is able to do whatever. And the next day when she went for surgery, she asked for another MRI or some exam, and they found out that the situation has changed completely.
Wow.
And the baby was born. She was 42 years old. Oh. The baby was born, and today is a great blessing, wow. And the baby is well. And we also know, Dr. Damien, you remember this couple from another church that came to see you, and or mentioned to us that the baby, the doctor had said the baby will be abnormal, but they said no, even abnormal, we want to keep the baby. Mm. And the baby was born perfectly normal.
Wow.
If they are Christians, they must look to know what the Lord feels about it, that whatever they do, it's about their relationship with the Lord, but then it's between them and the Lord. We cannot put our hand in it.
Okay. Yeah. Yes. Yeah. No, very true, you know, because I'm sure there are viewers listening to us out there who in Africa, we don't talk about these things. So I'm glad that Malaika addresses these things. And some way, if you are in that situation, you're listening to us today, I hope that you'll take heed and realize and count the cost before jumping into an abortion. And I think maybe Doctor will touch a bit on there's no time maybe, on the effects, you know, because it's not, after the abortion, there's so many effects that come with it. And most young girls or women don't think of that. They're just thinking of
the risk. They are, what risk are they encountering when they are doing it in a savage way, in not the classical surgical medical way?
Well, the medical way is quite safe. But the savage way, as we heard, with whatever method they use...
The backdoor way?
Yes. Exactly. It's a very high risk of bleed. So infection, and there's even a risk of uterus perforation. And if you have a uterus perforation, you might not be able to have any more kids. So be very cautious about.
And even risk of death.
Yeah, definitely. If you bleed and you have an infection, there's a very high risk of even mother death, as we heard before. So definitely not that way.
So your advice, Dr. Damien, is not to do it.
Well, obviously, I would never advise to do it, but it's, as you said, the mother's decision. But if it's your decision, do it the medical way and in a proper hospital and in a legal way.
Okay, thank you.
Amen.
We have come to the end of our episode. Mama Audrey, just tie it up, please.
Yes, I think what Auntie Zodwa said is the real thing, is count the cost. Don't let the social pressure be the deciding factor. Realize that you will have to live with it. You might be 12 today, you might be 14, you might be 16, you might be 18, but one day you'll be 30. One day you will look back and you will feel probably very bad about it, even though maybe statistics says that people feel good about what they've done, but I believe that there are scars that people will carry all their lives when they go through abortion. So whatever you do, especially if you're a Christian, take the courage, share with people who can understand you, share with people who can give you the right advice. If there's nobody know that we are here. You can share with us, and we will be able to encourage you one way or another, or even lead you to a church where they'll be able to support you during that time to go through that pregnancy, and maybe, who knows, that might be a great gift in the end that you will have from the Lord. So may the Lord bless you, and we are here for you. Please do not hesitate. Write to us. If you've got nobody to talk to, please know that we are here for you. And may the Lord lead you in whatever you are going to do.
Amen. Thank you. On that note, thank you very much, Mama Audrey. Ladies, thank you so much for your presence. Thank you so much, Dr. David.
It was a great pleasure for a very tricky subject.
Exactly. Thank you. We've tackled it with the grace of the Lord and your help, of course, and you guys, of course. Thank you for being with us, for staying with us till the end. Like, subscribe. Don't forget, if you haven't done it already, smack that bell. Till the next time, ciao.